Okay, moving on through the ECG course. We're still in level 1 and now we're at the Conduction Defects unit. And so we're going to have a quick lesson on the general overview of the causes, and then we're going to dig into each of those specific causes with accessory pathways, AV blocks, and bundle branch blocks. So in general, conduction defects are caused by pretty much three things. An accessory pathway, which is basically a short circuit fibrous connecting tissue that's grown across the insulating fibrous tissue, or that insulating tissue between the atria and the ventricles. And so really the AV node gets bypassed. And we'll talk about that in a specific lesson. Then we're going to also talk about AV blocks, partial blocks or complete AV blocks that delay that impulse transmission too much through the AV node. We want a little bit of delay, but we don't want impulses to never make it out or have too long a delay. Then the other possible conduction defect we're going to talk about is a bundle branch block, and both full bundle branches and then branches of bundle branches or fascicular blocks. Excuse me. So the causes of conduction defects can be anywhere from a congenital thing, that's typically the accessory pathway, the bypass tract, old age, disease, damage. Sometimes it's ischemia. The cells in the conduction system are like any other cells. They need a constant supply of oxygen and a good supply of glucose. And so if there is poor blood flow that's not bringing in enough O2 or enough glucose, then those cells can't make energy, they can't function right, and they start to misbehave. Similarly, the electrolytes need to be balanced. There needs to be the appropriate amount of sodium, potassium, calcium, magnesium, those sorts of electrolytes. And when those are off, then the conduction system cells are not going to operate correctly, and you're going to have conduction defects. Certain medications can impact the conduction system, either prolonging or shortening various intervals in there. And then when you put things in your body that really shouldn't be in your body, in street drugs and such, then you can have problems with conduction system. So accessory pathways, real quick in general, there should be that insulating line shown as a circle, a ring here, the insulation between the atria and the ventricles that forces that impulse down through the regular conduction pathway through the AV node. So the AV node gets a chance to do what it does. It slows the impulse, it protects the ventricles from atrial chaos. But if a bypass tract grows in across that insulating boundary and short circuits the impulse, then you end up with issues. Bypass tracts and accessory pathways, we're calling that the same thing. The most common disease process out there is Wolff-Parkinson-White syndrome. And the big three things about a bypass tract is your PRI gets short, your QRS gets wide, and you may have a delta wave, that slurred upstroke that you see in photo number 2 there on the right, that slurred upstroke to the QRS, which makes the QRS wide, makes the PRI short, and those three things go together. That's the hallmark of an accessory pathway. AV blocks are also going to be discussed. We have a pretty lengthy and involved lesson on them. Again, similar list: ischemia, 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 but more often than not, it's not ischemia. It's an old age, a disease to the conduction system where there's some medication or drug or other substance causing, or the electrolytes are imbalanced. But ischemia is something that we kind of deal with in the field. And so we want you to realize that when you see a STEMI in your patient, for example, when you see an inferior STEMI, then you can also figure out that that's the same artery that supplies the inferior wall also supplies the AV node. You have an anterior STEMI, the same artery that supplies the anterior left ventricular wall also supplies the bundle branches. And so the conduction defects can be tied to an MI, and which would further complicate the MI. Bundle branch blocks, another thing for us to talk about. We'll talk about a full left bundle branch block or a block in one of the two branches of the bundle branch, the fascicles, the left anterior, the left posterior, or we'll talk about a right bundle branch block. And then we want to introduce this concept of a bifascicular block. A bifascicular block, meaning there are two fascicles blocked, the right bundle and the left anterior fascicle, for example, which would only leave the left posterior fascicle to conduct impulses. And so, if something were to happen to that left posterior fascicle, now you pretty much have complete block, and the only thing saving your patient is a idioventricular rhythm, or it becomes cardiac arrest.